Yeah. So you can go through this card for a few minutes.
Sir, how can I address you for this role play?
Yeah. So you can call me Lincoln,
Lincoln. Okay.
Abraham Lincoln.
Okay, sir.
Yes. You can start.
Okay, sir. Good afternoon. I am Dr. Keval. So, how are you feeling now, Mr. Lincoln?
1 second. Let me open my notes. Search future land. Yeah. What you can do next time, whenever you're coming for speaking, just to tag that book, like how I am going to tag. Just to tag
Okay, sir.
that and write page number. Page number, how much? 20?
Sir, 21.
Okay, whatever it is, just write like that one. Finished. So immediately I'll go there. It is easy for me. Just tag the
Yes.
number.
This
Finished.
is page number 19, and the next role
Okay.
play is page number 21. Okay.
Okay, fine. No problem. This is 19. So just a tag like this.
Yes.
19. And then you can say 21. Both I tagged now. Is that clear?
Yes, sir. Okay.
So that's easy. Nah? For you also it is easy. For me also it is easy. Like that.
Yes, sir.
Okay. Now first one we are doing 19. Huh?
Yes, sir.
Okay. Yeah, let me open 19. Yeah. 19. Yes. What is this? 19. 26. 19. 23-year-old student. Patient.
Yes, sir.
Yeah. Sixth one. Keval Shah. Doctor. When is your test date?
Sir, it's not yet booked.
Not booked yet. Very good. Yeah. Not booked yet. Yes. Okay. Hmm. So, Keval Shah. I'm making the notes for you. This is exam concerns or sleeplessness. Okay, fine. Yes. So you can start. My name is Lincoln, Abraham Lincoln. Yes.
Good afternoon, Mr. Lincoln. It's good to see you again. So, how are you feeling now?
I am fine, doctor. I'm very fine, but I am little bit upset, little bit upset. I don't know how I am going to manage this condition. Please help me, doctor.
All right, Lincoln. I can understand what you might be going through right now. But last time, just a week ago, we had an examination, and it was quite sure that you are not suffering from any major medical condition, or you don't have any signs and symptoms. It's just that according to me, you are quite stressed, and also you are not able to sleep well. Is that correct, Mr. Lincoln?
Maybe you know better, but I am worried for the past few months. I'm just 23 and I'm still a student. This is not a very good sign, because I starting for exams and I feel stressed, extremely stressed, and I have had difficulty getting to sleep at night.
Definitely, John, I can understand you. I am here to help you in every step of the way. Also, the blood test which we requested earlier, the results are here, and I would like to tell you that the blood tests are quite unremarkable. So there is nothing to worry. And the stress which you are experiencing right now is just because of your upcoming exams. So I would like to suggest some ways to cope up with your stress. How does that sound, Mr. Lincoln?
Yeah, that's yeah, fine. That would be fine. But I want to ask you regarding the results of my blood test. Tell me more about that, doctor, please.
Okay, Mr. Lincoln, the blood tests are all good and they are quite unremarkable. So it doesn't point out to any medical condition or cause. So it's quite clear that this stress and your sleeplessness are both linked to your upcoming exams. That is quite clear. And you don't need to worry about anything else. So, do you have any other further questions or concerns?
Yeah, I don't have any concerns, but I want to know why I am feeling so tired. It really upsets me. I have a good diet and I don't drink and I don't smoke. But I don't do any exercise either.
Yes, Mr. Lincoln, it's quite understandable from where you're coming. But now I would like to discuss some ways uh, to cope up with your stress and also sleeplessness. Is that okay with you? Shall I proceed?
Yeah, of course.
Okay, so what you can do is you can avoid some stimulants like coffee and also sugary foods should be avoided, which will help you to sleep at night. Particularly before bedtime, you should avoid this coffee and sugary foods. Also, you should incorporate some exercises in your daily routine and find out some time for yourself to relax. That is how you can cope up with your stress. Is that clear, Mr. Lincoln?
That's absolutely clear, doctor. That's absolutely clear. But I want a medical certificate for my exam, which is in 2 weeks' time.
Well, I apologize for the inconvenience, but at this moment, I cannot write you a medical certificate because, as we discussed earlier, you don't have any medical cause or condition for which medical certificate is necessary. So it's just normal stress and sleeplessness. It can be treated with some definite ways which we have discussed above. So right now, I don't feel that you are in a need of a medical certificate. Am I making myself clear, Mr. Lincoln?
Yeah, you're worrying me. You're making me upset. You're making me stressed more. I won't write. You say, okay, you won't write my certificate, and I'm concerned that I will fail in the exam. You want me to fail in the exam? Why don't you give me a certificate? I can sit for the next time, right?
Well, I can understand you that you are quite worried about your upcoming exams, but according to some rules and regulations of this clinic and following the protocols, I cannot write you a medical certificate in this time of the moment. But we can definitely work out some other ways in which you can manage your stress and also appear for your upcoming exams. How does that sound, Mr. Lincoln?
That's really fine, doctor. That's absolutely fine. I agree with you, but I I know this will have a terrible effect on me. I'm going to fail the exam. I'm going to lose my battle. I don't you feel kind of about my results? How can I fail in the exam?
Well, John, based on our experience, if you follow my recommendations, you will definitely get back on track and you will be fit in no time. Also, your stress will be gone and you will be quite fit to attend your exams. So, I strongly recommend you to first try out the recommendations which we have discussed above. And what we can do is we can arrange a review next week so that we can see how well you are coping up with your stress and daily activities.
Okay, doctor, I cannot argue with you. I listen to you. I'll see you again. Okay, in the future. Okay, weeks before the exam. We'll see how it goes. I'll try to manage and I'll try to overcome the situation. Thank you for your suggestion, doctor.
Thank you, Mr. Lincoln, for accepting my suggestions. Are there any other further questions that needs to be answered?
Um, no, doctor, that's very clear. You have given me all the information. Thank you.
Okay, Mr. Lincoln, take care and see you.
Right. Very big sentence you have said, but there was a mistake, so I had to recall and write everything. Yeah, fine. Now let us go for the feedback. Yeah, Keval Shah from Surat, Gujarat, India. You are a doctor. I don't feel that level of confidence in your today's speaking. I don't know why. You are on panic mode because I'm shooting some questions and you're on defense mode. You're not on attack mode, you are on defense mode. Defense mode means you're trying to, you're scared actually, you're afraid, you're worried. What is this? What type of questions are these like that? You are not ready for such type of questions. That's what upsets me. Literally, I did not expect that you will go so low or so down. Yeah, you can speak a lot. You can speak a lot. This is a common condition. You can write afterwards. Don't write anything now. Okay, Keval.
Yes, sir.
It is there on the YouTube, so you can write it afterwards. You can note down afterwards. You can listen and write everything. Otherwise, you can go and see their transcription will be there. Transcription. You can just copy paste and eliminate the timings. That's finished. Remove the timings and copy. Finished. And then the full speaking will be there. You can make it into a dialogue. Then we can. You can do that one. You can do a favor that one to me. Go to the YouTube. Copy paste that transcript without time, and then you separate it, doctor patient, doctor patient, doctor patient, like that. Just give that one, then send it to me, then we can discuss on that one further. Is that clear?
Yes, sir.
Okay, we can go deeper. The good thing you have done is you did not book your test. That's a good thing, because many people, they first book the exam and then come and prepare. So you should give yourself proper time to prepare, then go and book for the exam when you're confident and when you're getting good scores. Okay, now here you could have told many sentences like this. Since you are a student, you have exams. Since you are a student and your exams are fast approaching, you are on panic mode. Just because, or the main reason is, you're not well prepared for your exams. This is quite a common problem in the student community. This is not just your case. Every student who is not well prepared will face the same situation. So your concerns are quite reasonable. Now, no need to brood over spilt milk. Past is past. Forget that. Now, you have two options. How to deal with the emergency situation now is the first priority, and how to avoid such situations in the future is the second priority. The short term goal is to overcome this situation, because you cannot avoid, you already situation you are facing, you cannot avoid, you have to survive this situation, and that is not the end in itself. You should learn a lesson from this situation, because of you are not preparing well in time, you're facing this problem. So taking this as a lesson, you have to safeguard your future. So the long term goal is, in the future timings, yearly portions, half yearly portions, quarterly portions, monthly portion, weekly, fortnightly, weekly portions, you can make it a plan. The lesson which is taught in the school, well in advance, the same day you can finish it off. So tomorrow what the teacher is going to teach, today itself if you prepare, you are ready for the class also. If the teacher is going to ask any questions, you can readily answer. Okay, so that is called preparedness. So if you prepare like this on a daily basis, so at the end of the month, end of the year, end of the day, that means end of the year, during the examination time, you're not going to be on panic mode. You are in the right track. So you're secured. You need not worry about the exam because you're well prepared. The frightening factor is the exams, and if you're ready for that one from in the beginning itself, that's it. Now, that's for future, but for now on, what you have to do is at least you have examination in 2 weeks time. Now, divide your portions. Divide your first, don't start reading, divide your portions. So this is what you can say. Okay, so you are not giving any suggestions here how to overcome the situation. You're just trying to treat the panic. Oh, okay, panic. Okay, you do this, do this, do this. But what actual situation? You have to research that situation, come out with a solution for that situation, so that he may not fall in this situation, and he can. So now you're saying exam fear. Yes, panic is there. Okay, no need to worry. Do like this, do. But what exactly his panic will not go off until you give the solution. So what you have to say here is, now for each subject you have 5 subjects. Okay. So early morning you take one subject. At 10 o'clock you take another subject. 2 o'clock you take another subject. 6 o'clock you take another subject, and night 9 o'clock you take another subject, or 8 o'clock. So divide into time zones, 1 hour each subject. So 5 hours you will schedule. In between you can do other things, and if you, right, and you can make a revision, and you can make testing and everything in that subject, particular subject. So now divide it 2 weeks time, that means 14 days. Now 14 days, you might have been having 14 chapters or 10 chapters. So daily one chapter, and if you have another additional time, then you can revise afterwards. So 10 chapters or 9 chapters, how many? Daily one chapter you can cover in that particular 1 hour time or 2 hours time. So 2 hours you can schedule, 2 hours for one subject, 2 hours for mathematics, 2 hours for science, or whatever it is, subjects. Okay, and you can complete it and just relax. So your burden will be minimized. So you can relax. By the time of examination, you will be totally relaxed. So this you can speak. Then again, you have to say, find out why you are feeling tired, because you are stressed. The stress is not allowing you to do anything. So that's why overthinking, panic mode, because of all these things, you are feeling tired. And this thinking is not making you to sleep, not allowing you to sleep. This is causing sleeplessness because your fear is not answered. Then next, the doctor, you're telling him, no need to worry. Okay, I cannot give you medical. See, you're asking for a medical certificate. There are quite some considerations before giving a medical certificate. Your condition does not, okay, uh, cannot qualify for a medical certificate. So it's not that much serious. If it is, then definitely I'll give you. But your condition does not qualify to get a medical certificate under any circumstances. There are some rules and regulations. As an individual, I sympathize with you. I understand your condition and I agree with you, but to that extent only. I can help you in every way possible, but the rules do not permit me. I am obliged to follow the rules and regulations. As a medical doctor, I have to abide by the conditions which demand a medical certificate, and the medical rules prohibit me from providing you a medical certificate. But let us think that is ruled out. So now there are some other alternative options which we can discuss. Do not read continuously for hours together. It will add to your stress. Your mind needs rest too. So after every 2 hours, go for a walk or watch a comedy, a part, 10 minutes a bit, or go and have a chat with your family members, or go prepare some tea, or go water the plants in the garden. Some relief activity. So now your mind will be refreshed, rejuvenated, and ready to receive more information. You are not overstuffing your mind with too many things. Now your mind has stagnated regarding one particular subject. Now you can take some other subject and put a little bit of it, and afterwards rest for some time. So this is the way how you can plan your 14 days effectively. This will give you some best results. You will be mentally ready on a daily basis. Gradually your portions will be reduced and you will gain confidence. At least early now you don't have any idea about anything, but at least a daily basis you will get little by little. Your confidence will be built on a gradual basis, on a daily basis. So this also you have to talk, no? He's telling exam problem. Okay. Try your level best. If in the examination timings, that time if some complications arise, then we can think about it. But now you're fine, right? So try to understand the situation. So you have to convince the patient properly. You cannot outrightly reject. So that's it. Yeah. So Dr. Keval, yeah, now you have time to speak for 1 minute. You can say whatever you want.
Yes, sir. I have understood what to say and what lines to use. Actually.
I gave you 1 minute. You don't have anything to speak?
Yes, sir. I have understood actually that how to be empathizing with the patient and what lines to use and everything. And I am going to work on that and also uh, how to tell the patient that I cannot prescribe something or I cannot write something because of certain rules and regulations.
Yeah. Right. Next. Next one. Okay, now I'm giving you your mistakes. Cope up with. You have used it 3 times, right? I don't know whether you
Yes, sir.
remember it.
Yes, sir.
You go back to the video and you see that 3 times you have used these words cope up with. Okay. But do you know that it is a mistake? Do you know what is the right form of using this style? Do you know? Yes or
No,
a
sir.
no?
No, sir.
No. So then I'm going to tell you. Cope up with is wrong. Cope with is right.
Okay.
Never say cope up with. Cope with. That's it. Okay. So maybe, okay, you want a clarity. Then you can go to the dictionary, Cambridge Dictionary, and check that one. But I'll take you there. Yeah. I'm going to take you to the Cambridge Dictionary now. So cope. Can you see cope with?
Yes, sir.
Cope up will not be there. Cope with. Is that clear?
Yes, sir.
You must say cope with. There is nothing called cope up with. Cope with.
Okay,
See
sir.
everywhere. Cope with. Cope with. Cope with. Okay, cope with. Understand?
Yes, sir.
Cope with. Everywhere you see the same thing. Okay. That's it. Everywhere you see, it is the same. Cope with. There is no cope up with. Okay.
Yes, sir.
So don't. You are using a very special phrase and you're spoiling the show. That's it. Cope with. Okay.
Yes, sir.
Yeah, cope with the situation. Right. Cope means to deal successfully with a difficult situation. Okay. To deal successfully with a difficult situation. Is that clear?
Yes, sir.
Right. So don't use that wrong structure once again. Don't use up with cope even by mistake again 3 times. Actually, you made a mistake 3 times. That is one side of the blunder. Making a mistake, okay, but 3 times making the same mistake is equal to 3 mistakes. Falling down is careless, is okay. Falling down, you fell down, okay, but falling down 3 times is it becomes a blunder. And next thing is you're making a mistake, that's okay. 3 times mistakes over. Then another side of the mixed problem is you're repeating the same thing 3 times. How can you do that? Don't you know that you have already used cope with? You could have said manage with, adjust with, or survive. Some other words you could have said. Nah? Why are you using the same word cope with the 3 times? That means you don't know how to use alternate vocabulary. You are not going to get marks again and again for the same words. If you have used manage successfully, adjust properly, survive the situation, come out with, come out of the problem, something you could have used. So don't repeat. There's another grave mistake you have done. Repeating the same words or phrases multiple times is not a good sign. Next one. Mr. Lincoln, Mr. Lincoln, Mr. What do you want to tell me? Do you want to tell me or remind me my name? Do you think that I forgot my name? You're only one doctor and I'm only one patient. Why so much attachment? Be professional. Personal attachment should be there. Over personalization is not fine. Mr. Lincoln, Mr. Lincoln, Mr. Lincoln. How many times you have told Mr. Lincoln? Just go and watch. One time in the beginning you said that's okay. In the middle, okay. One time in the end, okay. One time. That not necessary also. Because you know the patient, you know that name, you already the continuation, the rapport is maintained. Then why again so many times Mr. Lincoln? Okay. No need to remind me about my name because I know my name and only one person is there here. Two, three persons are there and you are changing the person, talking to him and him next time, next. Then you can address the name. Every time you change the person, you can say, oh, now Mr. Lincoln, now Mr. Abraham, now Mr. Like that you can. But you're only one person. Then why should you take the name again, time and again? That's not fine. The next one, eye contact. Eye contact. You're looking at the script. Always looking at the script doesn't go fine with the person who is in front of you. You're given 3 minutes time. Na? You're given 3 minutes time. That's enough. You see somewhere in the sky that shows that you are thinking, but you are looking into the text and reading means it gives a wrong sign. That means you are not very readily prepared. You are taking one word at a time and you are talking another word at talking. You're not even looking at the person. Okay, don't look at the person, no problem. Don't look at the text either. But when you are talking to a patient, you have to look into the eye. Without looking into the eye, how can you talk to the patient in front of him? Of course, in between, here and there, you can see there and here, up and down, no problem. But look into the patients at frequent because the continuity of the rapport should be maintained effectively throughout. Yeah. Then next, you said the last sentence. I'm very amazed at this sentence, but you made a mistake there. Are there any questions? Are there any questions? Till there it's fine. That needs. How can you say needs? Are there any questions that need? Questions that need. Questions is plural. So you should say need. And you said needs. Is there any question that needs? Is there, singular, any question, singular, that needs? But you're saying, are there any questions? And you said that needs to be answered. Do you think that I cannot catch you? Do you think that OET will not catch you? So be careful. Questions that need. Question that needs. Questions that needs. Both sides, yes, is wrong. When there is yes this side, the other side, no need of yes. When there is, I think you understand very clearly. You are a doctor and this is a very wonderful sentence. Very wonderful sentence. I was thinking, why you made this mistake? This is not the mistake of your level. So be careful. Okay?
Yes, sir.
Right. Now, yeah, fine. Don't get hurt if I'm telling something point blank. This is my style. Okay?
Yes, sir.
Yeah. I thought of taking 2 speaking sessions, but one is enough for now. You are doing well. Okay? In the evening, I'll
Yes,
give
sir.
you another speaking session. Okay?
Okay, sir.
Because
All right, sir.
I thought 15 minutes, 2 speaking sessions I'll take, but I have given a lot of explanation, right? That is more than a speaking session. So that's enough now. So you go listen to the YouTube and take that as a transcription. Okay? And if any good sentences are there, you put it in the group or send it to me. Okay? Right? And you'll learn
Okay,
them,
sir.
whatever I told, try to write them. Okay?
Yes, sir.
Yeah. So, dear friends, those who are watching on the YouTube, and here is my message to you. If you are interested, you can contact me on this number. This is my number. Right. For doctors and nurses, we have 3 places for doctors and, sorry, yeah, we have 3 places for doctors and 4 places for nurses for all skills or individual skills. So if anybody is interested for subscription, if you're really serious like Dr. Keval, if you're really serious to take all my suggestions, time is not my problem. Time is your problem. If you want quality, if you want to first attempt itself successfully clearing OET, if you want to get 400 plus or 450, then you come to me. Otherwise, please stay away from me because we need time to train you. Okay? We need a time to train you. If you want to clear in the first attempt, okay, then you approach me. Contact for subscriptions +919877867360. Grand Master Class. And this is Peter Simon with you. See you in our next session. Have a nice day. Bye bye.